Good day. I am Rachelle Calandria together with my group mates Stephanie Kate Dizon, Kristine Claire Fuentecilla, and Maria Fiona Laroza. We are here to present the drug categories of relevance to radiography. Let's start with analgesic, which is prescribed more frequently than any other medication on the market. This type of drug is used to treat both acute and chronic pain syndromes, such as arthritis, headache, muscle sprains, cancer pain, surgical and traumatic pain, nerve pain, and in some cases, anxiety. Basically, analgesic is a drug that relieves pain, and this class of medication can be subdivided into a multitude of different categories based on how each type of drug works to accomplish this task. The most common subclasses of analgesics are narcotics, nonsteroidal anti-inflammatory drugs, muscle relaxants, and acetaminophen. Narcotic medications, preferably called opioids by healthcare professionals, stimulate central nervous system receptors known as opioid receptors, hence the name, and cause a decrease in the perception of pain. These are very potent analgesics and are associated with the potential of physical and psychological addiction. That is why there's a strict regulation of this drug to prevent misusage. Examples of common narcotic medications include morphine, meperidine, fentanyl, hydromorphone, hydrocodone, codeine, oxycodone, alfentanil, remifentanil, tramadol, pentazocine, nalbuphine, and butorphanol. Another subclass of analgesic is the nonsteroidal anti-inflammatory drugs, which are used to treat pain associated with inflammation. These medications alleviate pain by blocking the generation and release of certain chemical mediators that stimulate a nociceptor, which is a pain receptor. This class of analgesic is not as commonly used in the operative setting because it has the potential to increase the risk of bleeding following some procedures. Common NSAIDs include ibuprofen, naproxen, nabumethone, diclofenac, ketorolac, indomethacin, phenoprofen, rofecoxib, celecoxib, and valdecoxib. Next is we have muscle relaxants, which are used to treat pain associated with muscle spasms by blocking nicotinic receptors at the neuromuscular junction or NMJ. This will lower the tone of the skeletal muscles. These drugs are often used in ailments such as whiplash, spinal cord injury with spastic muscles, and muscular strains or sprains. The most common relaxants include cyclobenzaprine, baclofen, diazepam, lorazepam, clonazepam, alprazolam, metocarbamol, and metaxalone. The last subclass of analgesic is the acetaminophen, commonly known as paracetamol. The exact mechanism by which acetaminophen produces its effect is unknown. Some theorize that it does so by preventing the central nervous system's creation of prostaglandins, which are in charge of causing pain. Over-the-counter medicine brands that contains acetaminophen are Tylenol, Nyquil or Dayquil, Excedrin, Alka-Seltzer Plus, Mucinex, Robitussin, and Goodies. While prescription medicines that contain acetaminophen includes Vicodin, Norco, Lortab that contains hydrocodone, Percocet, Endocet, Roxicet that contains oxycodone, Tylenol with codeine, Furicet that contains Vitalbital, and Ultracet that contains Tramadol. The relevance of analgesic in the radiology department cannot be overlooked, as invasive diagnostic and therapeutic treatments done in the interventional radiology suite can be uncomfortable. Thus, analgesics may be required to relieve patient discomfort as well as to improve diagnostic imaging, image-guided treatments, and radiation oncology procedures that involve patient cooperation. Proper use of these agents improves patient satisfaction and reduces procedure time. Another drug classification is anesthetics, which are agents that reversibly depress neuronal function, producing loss of ability to perceive pain and or other sensations. Anesthetics can be categorized into two: general anesthetics, which affects the entire body and makes a person unconscious. and local anesthetics that numbs just a small area of tissue where a minor procedure is to be done. General anesthetics act as a central nervous system depressants by producing muscle relaxation and loss of consciousness. These medicines stop the brain from responding to sensory messages traveling from the nerves inside the body. Unconsciousness caused by general anesthesia is different from a natural sleep. You cannot be woken from an anesthetic until the medicine are stopped and their effects wear off. This can be given either by inhalation or an IV injection. Inhalation gases include sevoflurane, desflurane, and isoflurane, while intravenous agents are propofol, which is the commonly used, ketamine, and etomidate. Local anesthetics, on the other hand, are drugs that stop the impulses from traveling through the nerves that transmit pain signals. They are also referred to as the numbing agents. Local anesthetics can be injected or sprayed in a small area to numb a specific location, or they can be administered adjacent to important nerves to numb a full limb. Benzocaine spray or lidocaine ointment is sometimes utilized to numb the mouth and throat for procedures involving placement of a camera such as ear, nose and throat, and office procedure or upper gastrointestinal endoscopy. While lidocaine, mepivacaine, bupivacaine, and ropivacaine are commonly used for injections at surgical sites. Interventional radiological procedures are an integral part of many patients' care with a multiplicity of interventions which are increasing in complexity and duration. These procedures can cause pain, anxiety, psychological, and physical anguish. So, to alleviate these effects, patients undergoing radiological treatments are routinely given anesthetic agents to lessen the unpleasant effects of an intervention and enhance patient outcomes. Next, we have antihistamine, which are medications used to block histamine from producing adverse effects such as itching, inflammation, respiratory distress, and overall allergic reactions. Antihistamines work primarily by competitively inhibiting histamine's ability to bind to cellular receptors, specifically the H1 receptors, found on nerve terminals, smooth muscles, and glandular cells. This is how they are thought to combat allergic disorders. However, antihistamines in general are quite sedating and may lead to respiratory depression when used in combination with analgesic medications. Common antihistamines include hydroxyzine and diphenhydramine. The newest form of antihistamine is much less sedating but not typically used in radiologic science. These drugs include fexofenadine, loratadine, and cetirizine. Radiological procedures use different contrast materials to enhance the image quality for an optimal diagnosis. Although it is rare, responses to contrast agents can vary from mild urticaria to potentially fatal anaphylactic reactions. And as an effort to prevent these kinds of incidents, antihistamines has been frequently used as a pre-medication to stop the recurrence of allergic reactions following the administration of iodinated contrast media. Now, let us proceed to anti-anxiety drugs, also called as anxiolytics, which are medication used to alleviate anxiety symptoms such as fear, dread, unease, and tightness in the muscles that can happen when under stress. Anti-anxiety drugs targets key chemical messengers in the brain. This is thought to help decrease abnormal excitability. These drugs work particularly on the limbic system of the brain by boosting the effects of the sedative neurotransmitter gamma-aminobutyric acid and, in certain situations, serotonin. Drugs in this class include diazepam, lorazepam, midazolam, alprazolam, chlordiazepoxide, clonazepam, and buspirone. Patients presenting for medical procedures such as diagnostic scans commonly feel anxious. This anxiety can make acquiring images that requires patient to be still for 30 minutes or more exceedingly difficult. Procedures often need to be repeated due to movement artifacts, which results in increased healthcare costs and increased dose of radiation for the patient. As an effort to mitigate these kinds of incident, radiologic technologies may be employed to administer an anti-anxiety drug when patients have computed tomography and magnetic resonance imaging scans to ease their fears, concerns, or claustrophobia-related anxiety.
So let us proceed to the antiarrhythmic drugs, also known as antidysrhythmic drugs. These are drugs that suppress excess electrical conduction within the cardiac system and thus decrease the arrhythmia production. Arrhythmia is the abnormal heart rhythm. It is either a slow or a fast heartbeat. In other words, these drugs calm our heart and bring back their normal rhythm. Antiarrhythmic drugs differ among themselves, but as a group, they block the sinoatrial node, atrioventricular node, and his Purkinje system or the electrical membrane current within the myocardial cell. They block electrolyte channels such as sodium, potassium, and calcium. Additionally, they also block beta receptors in the myocardium, which is the muscular wall of the heart. Examples of antiarrhythmic drugs are lidocaine, disopramide, morixizine, atenolol, acetbutolol, verapamil, adenosine, and digoxin. Since antiarrhythmic drugs falls under the cardiac medications, most of their uses are for interventional radiography. It is used in managing a variety of supraventricular and ventricular tachyarrhythmias during the insertion of a cardiac catheter. Additionally, research regarding the use of lidocaine in mammography shows a reduction in pain levels among patients. Antibacterial drug is a subset of antibiotic drugs. These drugs contain agents that destroy bacteria and suppress their growth or their ability to reproduce. Unlike antimicrobial drugs that focus on microbes, antibacterial medications are used in infections with bacteria or mycotic etiology. It attacks prokaryotes. Antibacterial medications is used in diseases like pneumonia. Common bacterial drugs are aminoglycosides, afenicols, carbaphenems, macrolides, penicillin, and quinolone. Antibacterial drug is the most common agent used by an interventional radiologist. It is used to prevent infection of an uninfected space, especially for invasive procedures, as well as minimize problems associated with the infected fluid collection, like septicemia when catheter manipulations are performed. Drugs that treat, prevent, and reduce the risk of blood clots breaking off and traveling to the vital organs of the body are anticoagulant drugs. Without them, blood clots can lead to life-threatening situations. They are used to treat blood clots that occur in blood vessels. Blood vessels are our arteries and veins. If an artery is blocked, it stops blood and oxygen from getting to parts of our body. This can result to stroke, heart attack, and pulmonary embolism. Warfarin is the most common anticoagulant drug. It is an oral medication that prevents the absorption of vitamin K, thus preventing the formulation of blood clots. Other examples are heparin, enoxaparin, deltafarin, and lepiridine. Before going to the relevance, let's also talk about coagulant drugs. These are the opposite of anticoagulant drugs. These are drugs that promote coagulation and control bleeding. A coagulation is the process of changing blood from a fluid state to a solid state. They are also called anti-inhibitor coagulant complex and is used by patients with hemophilia or patients suffering from a disorder that can bleed uncontrollably in response to a relatively minor injury. Our vascular system maintains an intricate balance between the tendency to clot and the need to unclot. But if a person is having a hard time clotting, coagulant drugs are needed. Examples of systemic coagulants are ethamsilate, fibrinogen, and tranexamic acid. As radiographers, we should be careful when dealing with both of these drugs. If a patient is taking anticoagulant drug or a patient has hemophilia, during interventional radiography, there is a higher risk of internal bleeding that cannot be controlled. Therefore, it is important to ask about the medical history and medications of patients to be able to report them immediately and to avoid complications. Antidepressants from the world itself are drugs that act to treat clinical depression that results from neurotransmitter deficiencies. Depression involves a persistent feeling of sadness and loss of interest. These drugs usually enhance the central nervous system levels of serotonin and norepinephrine, which ultimately elevates the depressed mood into a more normal state. It requires weeks to become fully active. Common antidepressant drugs are amitriptyline, imipramine, amoxicillin, nefazodone, trimipramine, citalopram, and nortriptyline. When a person needs to be diagnosed with a mental illness, the psychiatrist uses brain scans from CT scans, MRI, and PET scans to be exact. In a study of Trifiro et al., the greater adherence to antidepressant treatments is associated with slightly reduced number of diagnostic tests needed and is one of the several factors affecting the appropriateness of diagnostic tests. In other words, if patients are adhering to their medication, the psychiatrist will have an easier time determining what diagnostic imaging test is appropriate for the illness.
Let's now discuss antiemetic drugs. These are medicines that ease nausea or vomiting, and they can be prescribed or bought over the counter. There are different antiemetic drugs that are designed to address nausea and vomiting stemming from different cases. Because nausea and vomiting, we do not just experience this when we ride carousels, right? This may also be caused by a stomach flu, morning sickness, anesthesia, and even cancer treatments. So, let's tackle them one by one. First, we have the antiemetics used to reduce nausea and vomiting caused by motion sickness. The antiemetic drugs used for this are called antihistamines. It can prevent motion sickness not because it blocks the histamine receptors, but rather because of its central cholinergic blocking properties. So basically, some antihistamines are anticholinergic drugs as well. And anticholinergics block the physiological action of acetylcholine, right? That includes its role as a neurotransmitter that stimulates nausea. Now, these antiemetic drugs work by desensitizing the inner ear, or keeping it from fully sensing motion, because the inner ear plays an important role in balance and it's very sensitive to movement, such as sitting in a moving car or a boat. Examples of antiemetic drugs for motion sickness include diphenhydramine, or the very famous Benadryl. We also have meclizine, promethazine, and dimenhydrinate. Let's now go to the antiemetics used to reduce the symptoms of a stomach flu. Gastroenteritis, or the stomach flu, is caused by a virus or a bacteria. Although vomiting can help get rid of any stomach irritants, excessive vomiting can still damage your digestive tract. Also, nausea may prevent a person from eating and drinking enough necessary nutrients, and this may also result to dehydration. That's why antiemetics prove to be important for people who have the stomach flu. So, how does it work? Well, antiemetics can relieve the symptoms by coating the stomach lining. Now, antiemetic drugs for the stomach flu include bismuth subsalicylate, which is more known for its brand name Pepto-Bismol. We also have the combos of orthophosphoric acid, fructose and glucose, as well as sodium citrate, dextrose, and fructose. Of course, we also have antiemetics for pregnant people who are experiencing morning sickness. However, physicians usually prescribe them only when nausea and vomiting are severe, when it's already interfering with the person's daily life, such as in the case of people who have hyperemesis gravidarum, a condition where there is an extreme and persistent nausea and vomiting during pregnancy. If it's not that severe, a few medications can help and are safe during pregnancy, as long as the physician carefully described the possible side effects of the drug that they are recommending. Antiemetic drugs used to treat morning sickness include dimenhydrinate and promethazine, once again, prochlorperazine, as well as vitamin B6. Now let's go to the antiemetics used after surgery. Why do we need them? Because the anesthesia used during the surgery may induce post-operative nausea and vomiting. Several antiemetic drugs can help, which include serotonin receptor blockers such as garnicitron and ondansetron. Also, dopamine receptor blockers such as droperidol and metoclopramide. And lastly, some corticosteroids such as dexamethasone. Lastly, for antiemetics, we have the antiemetic drugs to relieve the symptoms of cancer and chemotherapy. Chemotherapy often causes nausea and vomiting, which is why physicians may prescribe an antiemetic before and after a session just to help combat its side effects and improve the patient's quality of life. Antiemetic drugs used for chemotherapy include serotonin receptor blockers such as dulasetron, palonosetron, and again, garnicitron and ondansetron. We also have dopamine receptor blockers such as prochlorperazine, once again, NK1 receptor blockers such as aprepitant and rolapitant, and lastly, corticosteroids such as dexamethasone, once again. The relevance of antiemetic drugs in our field is mostly inclining to therapeutic radiology, which is also called as radiation oncology or radiation therapy. If recalled, oncology is the branch of medicine that focuses on diagnosing and treating cancer, and antiemetics happen to provide relief to patients who are experiencing the side effects of these cancer treatments. Let us now tackle antihypertensive drugs, which are used to treat hypertension or high blood pressure. Blood pressure medication is divided into classes because we are treating the whole cardiovascular system here, and it's not just a single anatomical part involved and at risk. First, we have beta blockers, which reduce the heart rate, the heart's workload, and the heart's output of blood, thus reducing blood pressure. Some of the common beta blockers are acebutolol, atenolol, butaxolol, and bisoprolol fumarate. Next, we have the ACE inhibitors, wherein ACE stands for angiotensin converting enzyme. Angiotensin is a chemical that causes the arteries to become narrow, especially in the kidneys, but also throughout the body. ACE inhibitors help the body produce less angiotensin, which helps the blood vessels relax and open up. Of course, that will lower the blood pressure as well. Some of the common ACE inhibitors are benazepril hydrochloride, captopril, enalapril maleate, and fascinapril sodium. Now we have the angiotensin II receptor blockers or ARBs. If earlier ACE inhibitors decrease the production of angiotensin, this one, angiotensin II receptor blockers, blocks angiotensin so it won't bind to any receptor. Thus, it will fail to constrict blood vessels. With that, blood vessels will stay open and blood pressure will not increase. Common ARBs include candesartan, eprosartan mesylate, orbisartan, and losartan potassium. Also, we have the calcium channel blockers. These drugs prevent calcium from entering the smooth muscle cells of the heart and arteries. Why? Because if calcium enters these cells, it causes a stronger and harder contraction of the heart. But if we decrease the calcium, the heart's contraction is not as forceful. Thus, these drugs can also lower blood pressure. Common calcium channel blockers include amlodipine mesylate, bepredil, diltiazem hydrochloride, and felodipine. We also have alpha blockers as an antihypertensive medication. These drugs reduce the artery's resistance, thus relaxing the muscle tone of the vascular walls. Common alpha blockers used to treat hypertension include doxazosine mesylate, prazosin hydrochloride, and terazosin hydrochloride. Now, there are alpha-2 receptor agonists as well. What do? These drugs reduce blood pressure by decreasing the activity of the sympathetic portion of the involuntary nervous system. When we say sympathetic nervous system, if we all can remember from our anaphy class, it triggers the fight or flight response of the body. So, these drugs basically reduce the production of adrenaline. Methyldopa is an example of this drug. Now let's go to the combined alpha and beta blockers. These are administered using an IV drip to patients who are experiencing hypertensive crisis. These may also be prescribed to outpatients who are at a risk for heart failure. Examples of this drug include carvedilol and lubetalol hydrochloride. We are not yet done with antihypertensive medication because We also have central agonists, which help decrease the ability of blood vessels to contract. These central agonists have a different nerve pathway than the alpha and beta blockers, but they accomplish the same goal of reducing blood pressure. Common central agonists include alpha-methyl-dopa, clonidine hydrochloride, guanabenzene acetate, and guanfacine hydrochloride. Now, there are peripheral adrenergic inhibitors as well, which reduces blood pressure by blocking neurotransmitters in the brain. It blocks the smooth muscles from getting the message to constrict. Take note though that these drugs are rarely used unless the other antihypertensive medications did not help. Examples of this include guanadrel, guanethidine monosulfate, and reserpine. Now, we also have diuretics and vasodilators as a group of drugs that can reduce blood pressure. However, I will not further discuss this because they have their own discussion as separate drugs in this report. Still, here are some examples of them. For diuretics, we have chlorthalidone and chlorothiazide. While for vasodilators, an example of this is the hydralazine hydrochloride. The relevance of antihypertensive drugs in the field of radiologic technology is evident during diagnostic imaging and most especially in angiography. Why? Well, many radiographic examinations require patients to have nothing by mouth, which means there might be an omission of hypertensive medications. And if the patient did not take their medicine, a radiographer must schedule them early, perform the imaging procedure quickly, and remain attentive. On the other hand, an angiogram uses X-rays and contrast media to take pictures of the arteries in the brain, the heart, and the kidneys. How? By inserting a catheter into the artery. Now, many angiographers are wary of performing arterial puncture on patients who have high blood pressure, thus the need to administer antihypertensive medications. If the patient's blood pressure cannot be acceptably lowered, then postponement or other imaging options will be considered. We are now onto the anti-inflammatory drugs, which are used to relieve pain, reduce inflammation, and decrease high temperature. There are two types of these drugs, the NSAIDs and the corticosteroids. Let's tackle them separately. Let's have first the NSAIDs, or the non-steroidal anti-inflammatory drugs. They are the most common pain relievers in the world that are non-narcotic. NSAIDs help alleviate pain. How? By reducing the release of prostaglandins. Now, what are prostaglandins anyway? Well, after an injury, prostaglandins are released as a vital part of the healing process. However, these prostaglandins cause the damaged areas of the body to swell, and too much swelling causes pain and muscle weakness. NSAIDs dampen down the pain that you experience in short-term injuries such as strains, joint sprains, backaches, headaches, or just general discomfort that you got after an injury. Common NSAIDs include aspirin, the very famous ibuprofen, ketoprofen, and naproxen. We also have corticosteroids as anti-inflammatory drugs. They are also called steroids because they are the man-made version of the steroid hormones that are normally produced by the adrenal glands. These drugs mimic the actions of the naturally occurring corticosteroids and may be used to replace corticosteroids in people who have adrenal glands that produce inadequate amounts of it. In addition, compared to NSAIDs, steroids are far more powerful drugs and are more effective at reducing inflammation. But of course, they also have more serious side effects, and because of that, they must be prescribed and monitored by a physician. Common examples of steroids include betamethasone, prednisone, prednisolone, and dexamethasone. These are usually prescribed to people suffering from asthma, bronchitis, colitis, and systemic arthritis, which are all long-term conditions. Many patients take NSAIDs as their primary line of treatment to pain. Now, most imaging modality in the radiology department are non-invasive. However, pain might still be present on people who are undergoing a combination of imaging studies, such as an X-ray plus an MRI scan or an X-ray plus a CT scan. If these patients are undergoing a series of diagnostic tests, it only means one thing. There is something to be monitored in their body. These are usually done to cancer patients. Now, CT and MRI scans tend to require more time in the radiology department. Hence, pain relievers can help these patients who are constantly in pain while they wait for the examination to finish. Now we are on to the antiseptic and disinfectants, which are non-selective, topically applied, and anti-infective agents that are widely used to kill microorganisms such as bacteria, viruses, and fungi. When we say non-selective, it does not have a specific target. It kills any microorganism, and one perfect example of this is bleach. When we say topically applied, it means it is applied to a body surface, including the skin or the inside of the mouth. When we say anti-infective, it prevents infections. Now, let's differentiate antiseptic and disinfectants as we go along. Antiseptics are topically applied on the skin and mucous membranes. Why? To kill microorganisms. However, be careful with its usage because some strong antiseptics can cause chemical burns or severe irritation called irritant contact dermatitis when they are applied to the skin without being diluted with water first or when they are left on the skin for far too long. Now, examples of these are alcohols, both isopropyl alcohol and ethyl alcohol, chlorhexidine and other biguanides, antibacterial dye, peroxide and permanganate, and halogenated phenol derivative. Whereas antiseptics destroy certain germs on the skin, disinfectants remove these microorganisms from objects. In fact, antiseptics and disinfectants share similar active ingredients. It's just that disinfectants tend to have higher concentrations, and those are totally not suitable for use on the skin or mucous membranes. Some examples of this include alcohols as well, chlorine and chlorine compounds, formaldehyde, glutaraldehyde, hydrogen peroxide, orthothalaldehyde, and peracetic acid. Just as how relevant it is for the aseptic technique to be observed in the hospital all the time to avoid acquisition and transmission of a contagious disease, the same goes in the radiology department. The usage of antiseptic agents and disinfectants in our department range from disinfecting equipment, workstations, hand hygiene, and more. Now, the last part of my discussion is all about bronchodilators, which makes breathing easier. How? Well, this medicine helps relax the muscles in the lungs and widen the airways. Bronchodilators also help remove mucus from your lungs because an opened airway means mucus can move more freely. One can easily cough it up. Now, we have three types of this: beta-agonists, anticholinergics, and theophylline. Beta-agonists activate the beta-2 receptor on the muscles surrounding the airways. This results into the relaxation of those muscles and the opening of the airways. This can be administered by inhalers or orally. This type of bronchodilator may be short-acting or a long-acting one. Short-acting bronchodilators are called quick-acting, reliever, or rescue medications because they relieve acute asthma symptoms or attacks very quickly. The action of inhaled bronchodilators starts within minutes after you inhale them and lasts for 2 to 4 hours, while long-acting bronchodilators are not used for a quick relief, but rather to provide control of asthma. Examples of short-acting and long-acting bronchodilators are already projected on the screen. Another type of bronchodilators are the anticholinergics. These, on the other hand, do not just treat asthma, but also chronic obstructive pulmonary diseases mainly. Common anticholinergic bronchodilators include ipratropium, rivefenacin, and tiotropium bromide. Lastly, we have theophylline, which is a relatively weak and inexpensive bronchodilator that somehow acts just like coffee. It treats asthma symptoms too, but mostly those that occur during nighttime. This is sold under the brand names Theo24 and Unifil. It is already a given that bronchodilators can treat the symptoms of asthma and COPD. However, they can also help in the assessment of the said condition, which is important in our field because if a condition can be assessed by a physician, it can be diagnosed, right? Now, assessment may be in the form of a bronchodilator test, wherein the patient will inhale the medicine and at the same time, an MRI machine takes scans of its effects inside the body.
Let's now move on to cathartic and antidiarrheal drugs. Cathartic is any drug used in the treatment of constipation to promote the evacuation of feces, while antidiarrheal drug is any drug that relieves symptoms of diarrhea, which refers to the frequent passage of a watery loose stool. Let's focus first with cathartic drugs, also called as laxatives or laxative drugs. It has four main types: saline purgatives, fecal softeners, contact purgatives, and bulk laxatives. So saline purgatives increase the volume of the contents of the bowel, stretching the colon and producing a normal stimulus for contraction of the muscle, which leads to defecation. Some commonly used salts are magnesium sulfate or Epsom salts, magnesium hydroxide or milk of magnesia, sodium sulfate or Glauber salt, and potassium sodium tartrate or Rachelle salt or Seidlitz powder. Next, fecal softeners. Fecal softeners act to increase the bulk of the feces. Liquid paraffin or mineral oil can be used either as the oil itself or as a white emulsion. Other fecal softeners have a detergent action that increases the penetration of the stool by water. The third type is the contact purgatives. It acts directly on the muscles of the intestine, stimulating the wave-like muscular contractions called peristalsis that result in defecation. So this type of laxative includes cascara, senna, ricinoleic acid or castor oil, and phenolphthalein. So after regular use, their effect tends to lessen. So larger and more frequent doses are necessary until finally they cease to be effective. They are useful, however, when short-term purging is required, for example, before surgery or after an illness. So the last type is bulk laxatives. It acts by increasing the size of the feces in part because of their capacity to attract water. So this group includes methylcellulose and carboxymethylcellulose, the gums agar and tragacanth, psyllium or plantago seed, and dietary fiber. Now, let's proceed to antidiarrheal drugs. In general, it may be divided into different groups based on chemical or functional similarities. These groups include adsorbents, antimotility agents, and bacterial replacements or probiotics. So first, adsorbents. These agents are thought to work by binding to and thereby neutralizing the actions of diarrhea-causing toxins that are produced by infectious agents, or by preventing the adherence of infectious agents to the walls of gastrointestinal tract. Examples of adsorbents used in the treatment of diarrhea include kaolin, pectin, activated charcoal, attapulgite or aluminum silicate, and bismuth subsalicylate or pepto-bismol. Next, opioids such as codeine and loperamide or Imodium, and anticholinergic drugs such as dicyclomine and atropine may be used to slow intestinal motility and to relieve pain associated with abdominal cramping. Lastly, probiotics. Probiotics consist of harmless organisms that interfere with the colonization of the gastrointestinal tract by pathogenic or disease-causing organisms. So the commonly used probiotics in the treatment of diarrhea include commercial preparations of the bacterium Lactobacillus acidophilus and the yeast Saccharomyces boulardii. When it comes to its relevance in radiology, clinically, these drugs are administered to increase passage of gut contents associated with intestinal impaction, to cleanse the bowel before radiography or endoscopy, to eliminate toxins from the GI tract, and to soften feces after intestinal or anal surgery. So reminder, the dosages for all of these drugs are highly empirical and usually extracted from human dosages. The next drug category is diuretics. It is any drug that increases the flow of urine. So they serve to rid the body of excess fluid or edema that accumulates in the tissues owing to various disease states. So aside from what I said earlier, diuretics promote the removal from the body of excess water, salts, poisons, and accumulated metabolic products such as urea. There are many types of diuretics, but most act by decreasing the amount of fluid that is reabsorbed by the tubules of the kidneys. Hence, the fluid passes back into the blood. So the most widely used diuretics is the benzothiazides. Example given is the chlorothiazide. It interferes with the reabsorption of salt and water by the kidney tubules. So instead of being reabsorbed, the salt and water are ultimately excreted, thus increasing the flow of urine. They are more convenient than some other diuretics, for they can be taken orally in the form of pills. And these drugs also used to reduce high blood pressure or hypertension. So another type is mercurial diuretics. Example given is calomel. It works just like benzothiazides, but are less easy to use. And another class of diuretics are substances that cannot be reabsorbed by the kidney tubules and thus limit the reabsorption of water by the tubules. These include mannitol, sucrose, and urea. Other diuretics, example given is acetazolamide, which works by blocking the reabsorption of sodium bicarbonate by the tubules, thus increasing urine. So for its relevance in radiology, diuretics improve visualization of the urinary tract in computed tomography urography in adults, and as well as in magnetic resonance urography in adults and children. It can also help to diagnose upper urinary tract obstruction in intravenous urography, ultrasonography, and dynamic scintigraphy. The second to the last drug category is the sedative and hypnotic drugs. These chemical substances are used to reduce tension and anxiety and induce calm or sedative effect, or to induce sleep or hypnotic effect. So most drugs exert a quieting or calming effect at low doses and a sleep-inducing effect in larger doses. And these drugs tend to depress the central nervous system. The distinctive characteristic of sedative hypnotics is their selective ability to achieve their effects without affecting mood or reducing sensitivity to pain. So for centuries, alcohol and opium were the only drugs available that had sedative hypnotic effects. The first substance introduced specifically as a sedative and as a hypnotic was a liquid solution of bromide salts, which came into use in the 1800s. Chloral hydrate, a derivative of ethyl alcohol, was induced in 1869 as a synthetic sedative hypnotic. Paraldehyde was introduced into clinical medicine in the 1880s and was followed by the synthesis of barbital in 1903. Phenobarbital became available in 1912 and was followed during the next 20 years by a long series of other barbiturates. In the mid-20th century, new types of sedative hypnotic drugs were synthesized, chief among them the benzodiazepines, or the so-called minor tranquilizers. Barbiturates were extensively used as sleeping pills throughout the first half of the 20th century. They also were used to reduce voluntary inhibition during psychiatric examinations. Among the most commonly prescribed kinds were the following flashed on your screens. In higher doses, however, they depress the central nervous and respiratory systems to the point of coma, respiratory failure, and death. So the use of barbiturates declined after the development in the 1950s of the benzodiazepines. The latter are more effective in relieving anxiety than in inducing sleep, but they are superior to barbiturates because of the reduced dangers they present of tolerance and addiction, and because they are much less likely to depress the central nervous system when used at high doses. In addition, they also require a much smaller dosage than barbiturates to achieve their effects. So the benzodiazepines include the following you see on your screens. They are, however, intended only for short or medium-term use, since the body does develop a tolerance to them and withdrawal symptoms like anxiety, restlessness, and so on, and can develop even in those who have used the drugs for only 4 to 6 weeks. Antipsychotic drugs or major tranquilizers, tricyclic antidepressants, and antihistamines can also induce drowsiness, though this is not their primary function. Most over-the-counter sleeping aids use antihistamines as their active ingredient. Alcoholic beverages in particular are only of modest benefit in inducing sleep. On frequent exposure to alcohol, the nervous system adapts to the drug, and this results in early morning awakening. For its relevance in radiology, interventional procedures can produce pain, anxiety, and physical and mental distress. That's why analgesia and sedation in the interventional radiology suite are given routinely during interventional procedures and allow a safe, comfortable, and technically successful procedure to be performed. Appropriate sedation decreases the patient movement, patient anxiety, pain perception, and is crucial to successfully perform percutaneous interventions. Last but not the least, vasodilators and vasoconstrictions. From the name itself, these are drugs that cause dilatation and constriction of the blood vessels. Let's look into vasodilators first. Vasodilators are drugs used for relaxing the muscles of the blood vessels to treat severe conditions. It may either act directly on the arteries or veins to relax them or act via different mechanisms to produce dilation. Severe hypertension or angina is caused due to increased resistance of blood flow in the blood vessels. Thus, vasodilators dilate the blood vessels to increase blood flow and relieve pressure. Generic brand names of vasodilator includes the following. Here is the continuation of examples of vasodilators. On the other hand, here is vasoconstriction. It is the narrowing or constriction of the blood vessels to make its opening smaller. It happens when smooth muscles in blood vessel walls tighten. Vasoconstriction medications includes the following: alpha adrenoceptor agonists, vasopressin analogs, norepinephrine, and so on. For its relevance in radiology, vasodilating drugs prevent or relieve arterial spasm and enhance visualization of distal arteries through increased blood flow. Medications that vasodilate the coronary arteries are frequently used during coronary angiography and intervention. In conclusion, the preparation of drugs is often a responsibility of radiologic technologies. Therefore, we are expected to have broad knowledge of drugs, including their classifications, actions, interactions, reactions, principles, and methods of administrations, as well as the skills necessary to assist with drug administration in many different clinical situations. So we hope we somehow assist you in this report. So that would be all. Thank you for listening.